Two on Your Side exclusive. Two of Western New York's biggest employers are in the middle of a heated negotiation that could impact the health care of tens of thousands of local families. Will you have to pay more in out-of-network costs just to see your doctor? Well, this dispute involves Catholic Health and Highmark Blue Cross Blue Shield. Catholic Health says Highmark is getting more money in premiums, expected due to inflation, but not passing along enough of that to hospitals and doctors and nurses. The two companies have until the end of February to come up with a new contract to continue their services as in-network. We have both sides of this tonight, beginning with our exclusive interview this afternoon with Catholic Health CEO Mark Sullivan. I know that some things are proprietary in terms of negotiations and dollar figures, but can you assure the viewers who are watching right now that Catholic Health is coming to the table with reasonable expectations here?
Absolutely. There's no doubt. We are not asking to cover the costs of Catholic Health. That is not what we're doing. We're asking for meaningful increases that reflect the inflation that our nation is experiencing and every other industry throughout our country. We're looking for moderate, what we call increases relative to inflation. The trend for the last decade has been 2.1%. That's unheard of now when you look at the inflation in the last 12 months. There's not a health system in the country that could sustain itself based on that. Remember, healthcare is open 24/7, regardless if you're able to pay. And it's also important to note that record profits have been had by Highmark, the plan, if you will, in the past. And all we're looking for is between the rate increase they receive from the Division of Financial Service in New York State is to support the caregivers at the bedside and ensure that healthcare with the increasing per unit cost is recognized so we can build sustainability for healthcare as we're transforming healthcare.
Is the contention here that Highmark isn't being asked just to give Catholic Health a bunch more money because of inflation, right? That they are getting more money and not kind of passing that along to the people who are providing the care?
That's exactly right. I mean, the important part is that even without the rate increase, and remember, they received a 10 to 12.5% rate increase from the Division of Financial Services from New York State due to their filing that said increasing healthcare costs. So at the basic 8th grade level, you would think that if healthcare costs are increasing, that premium increase would be passed on to the care providers, such as Catholic Health. That's not necessarily the case right now in our negotiations. So that's the first question. Number two is we don't need anybody to bail out Catholic Health. That's not what this is about. This is about justice, equitably being reimbursed based on inflation for the per unit cost. Our caregivers deserve the rate increases we gave them last year with our union negotiations. We're standing steadfast with the labor unions on that, and we need to be reimbursed based on the per unit cost of inflation as we rebuild healthcare. And our goal is to have a contract by the end of this year. There are regulatory requirements between both parties if that does not occur, that move into the springtime, but our goal is to have a deal, and we're willing to work with Highmark. We need them to take a step forward, a good step forward, and recognize the need in the community.
Is the risk here, though, that in the absence of a deal, that if my doctor, who I've been going to for a long time, is moved out of network, I mean, that seems like it could have a real life impact on people?
Correct. I don't want to speculate on any of that. I do know that it's well over 67,000 community members that participate within Catholic Health and with Catholic Medical Partners. And it'd be a travesty if Highmark was allowing this to happen. Our goal would be to have a contract. Those patients and physicians could be out of network if that does not occur. And our goal is to sit at the table until we have a deal. And that's what our commitment has been. We just need Highmark to make significant movement, which has not happened in the last 11 months.
All right, so today we took those concerns to Highmark Blue Cross Blue Shield and its Director of Corporate Communications, Kyle Rogers. Weren't the premium rate increases approved by the state because the cost of health care has gone up due to inflation? And wouldn't it make sense that that money then be passed on to the doctors and nurses and hospitals and the people who are absorbing the extra costs?
Exactly, yes. And they are being passed on to the doctors and hospitals. So that was those are premium rate increases that were approved earlier this year for those small group and individual plan members. And that was anticipating the increased costs of care for 2023. What we're negotiating with Catholic Health is above and beyond that. And so we have an obligation really on behalf of our nearly 1 million members to ensure that healthcare remains affordable and within reach. And that is what we're attempting to do in these conversations.
For people who are watching right now who are patients of Catholic Health doctors or who go to Catholic Health hospitals who are worried about what would happen after the end of February, is Highmark committed to reaching a deal here?
Yeah, we have a long-standing partnership with Catholic Health, and we understand the value that they provide to our community. So we are very much committed to reaching an agreement. We have time. There's over 3 months until the end of our negotiation period to reach an agreement. And so we are working really hard to make sure that Catholic Health remains in our network for our members. What Catholic Health is currently asking for far exceeds what other hospitals in the region have agreed to. And so that is why, we still have plenty of time to work through this and reach an agreement. And we're committed to reaching an agreement, but we have to find an agreement that will not result in us having to pass on excessive premium rate increases to our members.
While the current contract expires at the end of this year, there is a 2-month grace period due to state law, and so technically both sides have until March 1st to come to an agreement.